Hi everyone, this is Evan from Capillary PT in Malta. Just going to give you a quick introduction video here as to some assessments that we do for the thoracic spine. So patients that come in with shoulder pain, neck pain, back pain of any sort, even lower extremity pain, we want to make sure that we're looking at everything as a whole. So I'm going to show you some ways that we do assessments for the rotation of the thoracic spine. So one of those techniques is we get patients into quadruped and we're going to drop your elbows down right to your knees. Now, this also gives us an assessment of what substitutions you may be doing in other areas of your body for compensation. And all we're going to do is we're going to put our hands on the back of our neck here. We're going to rotate our body upward. So, for example, one of the things that can happen that we look for is if we tend to extend our trunk and lift our bodies upward. That's one of the substitutions, which may be indicative potentially of a lower lumbar spine that's locked up. Same thing with shifting. I might shift my hips side to side as I rotate as a substitution. And the last substitution that we really look for is, are you just moving your shoulder, or are we actually getting that rotation from our thoracic spine? So depending on what we find, we do multiple treatment styles to fix that. We do some manual techniques, soft tissue mobilization, some different stretches, and self-corrective techniques that we would educate patients on how to do. I'm going to show you one more rotational kind of assessment that we do. So I'm going to grab a stick here, and I'm going to get into this lunging position. And depending on, again, the patient, certain assessments are more appropriate than others. So during this assessment, I'm going to get into this wonderful lunging position. I'm going to have the bar crossed around my shoulders, and I'm going to keep my feet planted, and I'm going to rotate. Now, some of the things, again, from a compensation standpoint that can happen is the front leg may actually adduct here or kind of drop inward. Not supposed to happen during the rotation, so there's some sort of breakdown in mechanics if we see that. Same thing if we start adding bending to either side, okay, to try to increase our ability to rotate. So a couple quick assessment tools that we look at. Hope you found this helpful. If you have any questions, or if you find that if you're doing these assessments at home and you want some expertise on maybe how to help correct these things, we're here to help. Thanks very much.